Brian Cueto.
Myra Leva.
And I'm Lisa Soto.
And we're here to talk about the effects of education on back incidents. So we first want to start out with what is VAP. VAP stands for Ventilator-Associated Pneumonia, and it's a common nosocomial infection that affects primarily the ICU. It's a major source of mortality rate increases in hospitals, and it can also complicate and prolong the treatment of immunocompromised patients. So risk of incidence and mortality rates. VAP affects 8 to 28% of mechanically ventilated patients. During the first 5 days of mechanical ventilation, there is a 3% risk of incidence per day. Afterwards, there's a 2% increased risk per day for the next 5 days, and a 1% increase every day thereafter. So the first 10 days alone, there's a 25% chance of infection. VAP mortality rates range between 25 to 50%, so it's still pretty significant in the ICU. VAP further complicates the treatment of immunocompromised patients. It can add anywhere between 5 to 48% to their morbidity rate. So this map is actually from the World Health Organization. It's the global pneumonia death rates, and as you can see here in America, there's less than 100 per 100,000 deaths per inhabitants. My country, which is the Philippines, their death rate is actually 1,400 to 2,100 for death rates per 100,000 people. The studies that we're actually referencing from came from Egypt, Malaysia, and Thailand. So they're all countries that don't necessarily have the same prevention methods that we have here, and it's not necessarily up to date as it is here. So why is this relevant today? High rates of incidence and morbidity rates continue to be problematic for patient care, and it's typically worse in underdeveloped countries, as you saw from that map. So what can be done? Education is perhaps the best tool to utilize when preventing the contraction of infectious diseases. Education helps establish guidelines and prevention methods. Staff, of course, must be willing to adhere to the already established prevention methods, and staff must be willing to pursue the relevant information themselves. So the materials and methods. We performed a literature search for VAP, prevention-based education, and its effect on the infection rates. We utilized CDC website, the Oxford Journal, Medscape, and PubMed databases. So the articles with research conducted in the ICU were preferred because, like I stated before, that is where VAP typically occurs in the ICU. Articles were also chosen based on the number of incidences before and after education about VAP and the improvements in prevention. Studies were conducted in underdeveloped countries with inadequate VAP prevention protocols because obviously those are the countries that we want to see an increase in their prevention protocols. Articles older than 5 years were excluded because we wanted the most relevant information and up-to-date information.
Okay, so our consensus are among researchers that found how the effect of implementing preventative measures has a positive effect. So this graph is based on a before and after implementing education on preventative measures. So this is based on a 1,000 ventilator days, which is the usage of a certain ventilator for a span of 1,000 days. So basically, these researches are gathered within 3 to almost 4 years. So this is just a visualization of our statistics. For Hospital A, which is located in Thailand, before any certain preventative measures that were introduced, there were 20.6 cases that were found. And after introducing some kind of any preventative measures, the rates decreased to 5.6. that is already for 59%, which is a totally huge difference. For hospital B, this is found in Malaysia. There are 30 cases found before, and then after there are 15. Those incidences were cut in half. That is a huge significance considering death rates. And for hospital C, this is located in Egypt. There are 66.5 cases found, and after there are 43 cases. The incidences decreased by 35%. So pretty much based from the statistics, and as you can see again from this graph, introducing any kind of preventative measures, educating hospital staff definitely decrease or, it will definitely lower the rates of incidences for any kind of certain hospitals.
Okay, for future direction, the education of staff should be focused on the pathophysiology, epidemiology, and prevention of that. Healthcare professionals should be encouraged to seek out evidence-based educational courses related to infection prevention. Healthcare facilities should have strict policies in place regarding specific practices aimed at preventing that in their facilities. The current CDC guidelines for VAT prevention are, number 1, keep the head of the patient's bed raised between 30 degrees and 45 degrees unless otherwise, unless other medical conditions do not allow this to occur. Check the patient's ability to breathe on his or her own every day so that the patient can be taken off the ventilator as soon as possible. And 3, clean their hands with soap and water and or alcohol-based hand rub before and after touching the patient or the ventilator. And when I seen this, it kind of dawned on me. I said, well, that should be number 1, because that's what we learn in the healthcare field, to clean your hands. So that should have been number 1. And then clean the inside of the patient's mouth on a regular basis. So oral care is also very important. Clean or replace equipment between use on different patients. And those are the current CDC preventions for that. So in conclusion, educating staff on the pathophysiology, epidemiology, and prevention methods of VAT showed a significant decrease in incidences. It is important for hospitals to provide appropriate seminars related to infection prevention methods. Staff must also adhere to any set guidelines. Global outreach is needed in order to introduce more advanced prevention methods to areas of the world that are in need. Thank you.
Any questions for the group? I know you
Actually, I'm wondering, in the details of the study, was there anything, what is it that caused that sort of 50, that's such dramatic? Was it the hand washing, or was there anything in particular you noticed with the educational interventions that they put in place that really made a difference?
Well, typically, so for the prevention methods, they were implementing the CDC prevention methods that were mentioned here. So that's probably the biggest thing. I know in my country, with the Philippines, we actually don't have those same prevention methods. So, in extension to this, like for the global outreach portion, I actually gave this PowerPoint as well as the poster to my aunt, who's a teacher in high school. And because, how many here have been to a hospital? And I'm pretty sure you've all seen like a Filipino nurse, right? So the nursing field is a big field in the Philippines. So it's important that they need these prevention methods. And it's not being widely implemented in the Philippines yet. So hopefully, like, people who take the opportunity to send this information to them, because we also don't entirely have access to the internet there either. I know my family does, but not everyone in that country does. So getting teachers to be more involved in the education of the students, especially since most students straight out of high school go to like trade school for nursing in the Philippines. So it's very important that it starts early in high school especially. So my aunt, she's only a math teacher, but she actually is friends.
Only a math teacher. Okay, no points for you.
I'm sorry, but math is not But so what happened is my aunt, who's a math teacher, she actually is friends with a lot of the biology teachers. So she gave all this information to the biology teachers, and this Sunday actually they're going to have like a little extra credit lecture for them. So hopefully things go pretty smoothly. Any more questions?
Okay. Our next group is here from the Department of Rehab and Movement Sciences, a little close to my heart. Representing the group today is Maggie Townsend and Laura Paley. They did the work with Tulsi Shah and Stephanie Burton, and their topic is what are the physical symptoms associated with postpartum depression, a meta-analysis and systematic review.